The mission of the George Institute is to focus on the most important health conditions in our current times. And we did realize that until before COVID had come along, that non-communicable diseases, chronic conditions were emerging as the most important health challenges for humanity, especially multi-morbidity, people with multiple conditions like this. So that's what we were focused on. But since COVID has come along, I think there is no doubt that this is right now the most important health condition. Not only the health condition, the most important condition that humanity has been faced with in our lifetimes. I think in the last century, until since the time of the last influenza pandemic. So it makes perfect sense, and it is completely logical for us to tackle this particular issue using the expertise that we have, which is around, like I said, using rigorous methodology to collect experience by doing randomized clinical trials. Because one of the things that everyone has been obsessed about right from the time the pandemic broke is to find the best therapeutic options for managing people with COVID or preventing people from developing this infection.
Can you just share some other challenges? Like, were there things that you anticipated that didn't emerge, or were there some unexpected challenges that emerged? And I guess, could you talk to that and how you were able to respond to those and move forward?
What we had anticipated, that a number of sites would be completely overwhelmed by the magnitude of clinical work, and they just wouldn't have the time to even talk about a clinical trial. Many of these people are trying to save lives every minute, and to at least a few of them, doing a clinical trial might seem like a luxury or an afterthought. But I have to say that there have been, for sure, a few people or a few groups that were not interested. But by an overwhelming majority, we have received encouraging response, and people have realized the value of why we need to do clinical trials. Not that things have been absolutely smooth, but that has not been because of lack of desire on the part of investigators.
What are some of your kind of short-term hopes and aspirations, as well as the long-term aspirations?
One of our important short-term aspirations is to make sure that our organization remains strong, our staff is appropriately taken care of, our research projects are managed appropriately, so that they still deliver what they the best evidence that they can, given the circumstances. So we are very focused on making sure that we continue to support our staff in their hours of need. One other process-driven aspect that we have become very focused on is how to do research during COVID. Because people cannot go to communities, patients cannot come to hospitals. So, for example, our clinical trials that have been going on for the last 4 or 5 or 6 years, some of them depend on patients coming back to hospitals every month or every 3 months or whatever, right? But right now they can't do that. So how do we collect data on these individuals? So we are having to develop new processes, developing rapid methods of remotely collecting data, both data that are simple outcome-related data, but in some cases we need even more detailed data. So how do we get that data? So developing those processes are important right now for that specific research project. But it also gives us lessons to then develop more efficient ways of doing research in the future.
What is one or a few things that you wish everyone would know about the community you're working in, and just the people that are part of your research studies?
And I think I have to say this is resilience in the face of such extreme adversity, especially and a kind of adversity that brings to focus the inequities that exist in our societies in sharp relief, right? And in this situation, how people who have pretty much lost everything are still trying their utmost to do their best, in this given situation. I guess that's the only word I could have, and I wish our health systems, our general societal response to this pandemic, it's been it's been so exacerbated by this pandemic. But this is not something which is unique, right? I mean, so it simply has brought to the surface the the deep fissures in our society and the deep divisions in our society, which have created several communities of haves of to different degrees and have-nots to a hugely different degree, and that gulf is very apparent. And I don't know what will it take to reduce this. It's not going to happen in a hurry, but from this if the society just comes out with this lesson that we need to do whatever we can to reduce this gulf, to minimize this gulf, uh, I think that would have been uh, as they say, a silver lining to this extremely dark cloud.